Hi, Dr. Rahgozar from Line Plastic Surgery in Los Angeles here. Today we're going to talk about breast augmentation using implants and fat grafting. Typically the patients that come in for breast augmentation consultation are looking to improve the size or the shape of their breasts, or both. Occasionally a patient will come in because of an asymmetry that they'd like to have corrected, or some volume loss that's occurred either from losing a lot of weight or after pregnancy and breastfeeding. There are many types of implants that we can choose to use for breast augmentation. The typical implant that we like to use here at Line are Sientra implants. And these implants will range in size anywhere from 180 cc's upwards to 500 or 600 cc's, as well as various projections, such as low projection, moderate projection, and high projection. During the consultation, we will work with you to match your anatomy with your desires to give you the best result and best outcome achievable. Fat transfer is another option for breast augmentation. This is typically done in the patient that wants a slight, more subtle augmentation and is already having, for example, liposuction performed where fat is being removed, and it does have the downside where not all the fat that is injected will survive. We typically state that about 50% of the fat that we inject will stick around. This is probably more beneficial in a patient who's already undergoing liposuction, and instead of throwing the fat away, we can use that fat to augment a body part. Before your breast augmentation procedure, you'll go through a screening process to ensure that you're an ideal candidate for the procedure. On the day of surgery, you'll meet with me and we will do some surgical markings before you go to the operating room, where the anesthesiologist will put you to sleep. Once you're asleep, I'll make an incision about 2 inches long under the crease in your breast, which will be nice and hidden. From there, we will place the implants under the muscle. We do a secure 4-layer closure and then place you in a surgical bra. All in all, the procedure takes approximately 1 hour. During the recovery period, we will have you wear a sports bra or a surgical bra for about 4 to 6 weeks. This is to minimize irritation to the incision, to the surgical incision that'll be under the breast. You can expect to go back to a desk job probably in about 3 to 5 days after surgery, and a more active job probably about 2 weeks after surgery. You can do moderate physical activity about 4 weeks after surgery, and unrestricted physical activity at about 6 weeks after surgery. During the recovery period, we will also guide you on how to do breast massage so that we can keep the breasts feeling soft and natural, as well as we will show you tips on what you can do to minimize the scarring. Breast augmentation procedures are one of my favorite procedures to perform. The patients are very happy with the results, and the results are practically instantaneous. Be sure to book your surgery with a board-certified plastic surgeon here at Line Plastic Surgery in Los Angeles for the best possible outcome.